what are the basic imaging tests for Parkinson's disease, and are there any new tests on the horizon?
So actually, Parkinson's disease is still a clinical diagnosis. There is no one definitive test for Parkinson's disease. And it is tricky to diagnose. I will say, there's, based on just clinical exam, there's about 70% accuracy in exam. So we do like to try and have tests that support the diagnosis, not prove or disprove. That test does not yet exist. So an MRI scan is always very helpful to establish what we call kind of baseline structural imaging of the brain to make sure there's no tumor or stroke or bleeding or malformation or water on the brain. Outside of that, we do use, there's DAT scan imaging, DAT scan imaging, which is done through radionucleotide. There's an IV placed through the vein, and then a special form of dopamine is delivered through the IV infusion. And after a period of time, a few hours, the patient undergoes a special CAT scan, and we look to see how the brain handles dopamine. And if it can handle dopamine well, that does not show Parkinson changes. If it's abnormal, that supports there may be Parkinson. And it's about 70 to 90% accurate. And there's a newer test called this alpha-synuclein punch biopsy. And that has been out for a couple of years now. It does turn out that the chemistry changes of Parkinson's can frequently be detected in the nerves of the skin, the cutaneous nerves of the skin. So that was the trick for the biopsy, is by taking a very small sample of skin from the back of the neck.
Is that the three punches?
That's
neck,
correct.
The hip,
The back of the neck, thigh, and calf, and it's stained in a lab in Scottsdale, Arizona. And they send us a report back in a few weeks, and it's about 95% accurate. But, as I've mentioned to some of my colleagues, if we have done and approved, 60 plus biopsies, and it has 95% accuracy, 1 out of 20 may be spurious, a false positive or false negative.
Thank you.
And so we cannot hang our hat on this DAT scan or this biopsy. We have to take it holistically with exam, history, labs, imaging, biopsy, and we are allowed to change our diagnosis over time. And that's sometimes what happens.